be going through intussusception. Intussusception is a condition where the bowel invaginates or telescopes into itself. Picture the bowel folding inwards. This thickens the overall size of the bowel and narrows the lumen at the folding area, leading to a palpable mass in the abdomen and obstruction to the passage of faeces through the bowel. It typically occurs in infants 6 months to 2 years of age and is more common in boys. Intussusception is associated with various conditions: recurrent viral illnesses, henoxyonline purpura, cystic fibrosis, intestinal polyps, and meccal diverticulum. So how does it present? Well, it presents with a child between the age of 6 months and 2 years with severe colicky abdominal pain. There will be a pale, lethargic and unwell looking child, red currant jelly stools, a right upper quadrant mass on palpation, which is described as sausage shaped, vomiting, and intestinal obstruction. A quick Tom tip for you: look out for the red currant jelly stool in your exam, as this indicates intussusception as a diagnosis. The other classic feature is the sausage-shaped mass in the abdomen. The typical child in the exam will have a viral upper respiratory tract infection preceding the illness and will have features of intestinal obstruction such as vomiting, absolute constipation, and abdominal distension. An ultrasound is the initial investigation of choice. So how do we manage intussusception? Well, the diagnosis is made with an ultrasound scan or a contrast enema. Therapeutic enemas can be used to try and reduce the intussusception. Contrast water or air are pumped into the colon to force the folded bowel out of the bowel and into the normal position. If the enemas do not work, then surgical reduction may be necessary. If the bowel becomes gangrenous due to a disruption of the blood supply or the bowel is perforated, then surgical resection of the bowel is required. Finally, there's 4 complications you need to remember: obstruction, gangrenous bowel, perforation, and death.